In this video I explain the foundations of solution-oriented therapy. You will learn how this method helps people solve their problems in a positive way. Solution-oriented therapy is a form of therapy that focuses on solutions rather than problems. It assumes that every person has the abilities to overcome challenges. This therapy emphasizes the resources and strengths of the individual. Instead of lengthy problem analyses, it looks for solutions that can be applied in everyday life. In solution-oriented therapy, concrete goals are worked on together with the therapist. The therapist assists in finding solutions that are feasible for the patient. Often questions are asked that encourage the patient to reflect and open up new perspectives. The aim is to quickly bring about changes in behavior and thinking. This therapy is suitable for people who are in a difficult life situation and are seeking a quick solution for their problems. It is especially helpful for individuals with anxiety, depression, or relationship issues. It can also provide valuable support during stressful life events. It is for people who are willing to actively work on their solutions. Unlike other forms of therapy, solution-oriented therapy does not focus on the causes of problems. It talks less about the past, and focuses more on the present and future. The therapy is often shorter and more goal-oriented than other approaches. The patient is viewed as competent and capable of initiating change. In solution-oriented therapy, the strengths and resources of the patients play a central role. Every person has skills that can help them solve problems. The therapist encourages the patient to recognize and use these resources. This way, the patient is actively involved in the solution process and feels empowered. In solution-oriented therapy, questions are asked that guide the patient toward a solution. Questions like, "What is already going well?" or "How have you solved similar problems in the past?" are typical examples. These questions help to notice and continue positive changes. They promote the patient's self-confidence and personal responsibility. The duration of solution-oriented therapy varies, but it is generally shorter than many other therapy forms. Often a small number of sessions is enough to achieve change. The focus is on finding quick solutions that can be applied in everyday life. In some cases, the therapy can be successfully completed after just a few sessions. The therapist plays a supportive role in solution-oriented therapy. They are not an advisor, but a companion who helps the patient find solutions. The therapist asks targeted questions and provides space for reflection. The patient is seen as an expert in their own life situation. Various methods are used in solution-oriented therapy to find solutions. These include setting goals, finding approaches to solutions, and working with positive experiences. Visualizations or discussions about successful situations are also used. The focus is on the patient becoming active themselves and developing solutions.